doctors are gaslighting their patients more. Healthcare is a field that you can't Uberize.
He's been dubbed People Magazine's sexiest doctor alive.
Mikhail Varshavsky.
Dr. Mike Varshavsky.
Mike, what made you want to be a doctor?
I wanted to be able to be valuable and helpful to people. I also actually have another career.
Dr. Mike Varshavsky.
That's not something I recommend people do.
Yeah, you want to keep that nose.
When I was a resident in the hospital, I would sit and talk to patients, and I would see that they would always be fed some kind of misinformation where someone says, why did we even get vaccinated for polio? We don't even see it anymore.
Well,
That's a young mind.
Yeah, exactly. As a result, I said, how can I reach more than 30 people? Well, I could do it on YouTube, where we have almost 3 billion views.
Whoa, in the billions.
Trying to keep up with you guys.
Doc, don't forget to tell us about the airplane incident.
That was like a Grey's Anatomy episode in real life.
Passenger went into anaphylactic shock during the flight.
Thankfully, Dr. Mike was on board.
So much we don't know about the body. It's really incredible. When is it time to go seek help? And that's a good question. But the answer is...
Ladies and gentlemen, welcome to the Retirement House Podcast. We are so pleased to be sitting here today with Dr. Mike. And we usually do a big deal with our introductions. But today, Dr. Mike, since you are not only a medical professional, but a social media megastar, why don't you tell us, our audience, something about yourself and what you're into?
Okay, fair. I am a primary care doctor, which means that I take care of patients of all ages, whether you're 1 day old or 100 years old. I take care of you. And that's the beauty of my job, where I've actually taken care of patients that I ended up helping them deliver their babies. Their babies become my patients. They grow up. Their grandparents become my patients. And it's really a beautiful career. But in addition to this, I guess by day I'm a doctor, and by night I do content online, YouTube, TikTok, Instagram, where I educate the world about their bodies, about their health, misinformation that they see online. And so far, it's been an amazing journey where we have almost 12 million subscribers on YouTube and 3 billion views.
Whoa, in the billions.
Trying to keep up with you guys.
No, you do. Billions.
Are you married?
You've topped us.
Not for me.
Oh, okay. Just in general.
Just in general.
In general, I'm not married.
Because I was wondering when you found the time to spend with your wife between daytime medicine and nighttime internet.
Yeah, I get not much time for that, sadly. So no wife. I do have a big fluffy dog.
That's
So
important.
that is part of it.
Yeah.
I also actually have another career that we didn't mention in the introduction.
what is it?
Last year, maybe a year and a half ago, I became a professional boxer as well.
Oh, I heard
what?
something about that.
Yeah.
Why did you do that?
It wasn't a good idea. I'm going to say that first. That's not something I recommend people do.
Yeah, you want to keep that nose and...
I think more about the brain, but the nose I appreciate as well.
Yeah, you can.
There's a lot of concussions and head injuries that happen. But for me, it was a challenge. It was something that I wanted to always achieve for my entire life. And it was cool to be able to have that opportunity where I actually fought on Showtime pay-per-view boxing. Yeah. And I did it for charity. We raised over $100,000 for the Boys and Girls Club here in Harlem.
Wow.
So at home, I wouldn't recommend you become professional fighters, but take a boxing class, hit a bag. It's a great sport, good for the heart.
Keep you in good condition.
Exactly.
Now, is it true that you got your doctorate at 24?
Yeah.
How'd you do that?
Yeah, I'm like a fake Doogie Howser, if you will. You know, it's funny. Most people, when I say that joke, they don't get it, but I appreciate to be in a room full of folks who
Our
get it.
generation, yes.
I did an accelerated 7-year medical program where you do 3 years of college and right away you continue on to med school, do 4 years of med school. Actually, on the first day of med school, I was the sole student out of 300 not invited to the opening day party because I wasn't 21.
Wow, that's funny.
Kind of messed up.
We've got to run on young people today.
I'm not young anymore. I've been practicing medicine for 10 years already. So.
Yeah.
Trust me, compared to us, you're young.
I don't know. You look more spry than I do.
Mike, what made you want to be a doctor?
You know, I think it was a combination of the fact that I had a passion for learning about the subject. I enjoyed learning about the body. I wanted to be able to be valuable and helpful to people. And I had an early experience when I came as an immigrant to the United States, watching my dad go through medical school for the second time in his life.
Wow, because he had been qualified in another country.
Correct.
What country?
What
In
country?
Russia.
A lot
Yeah.
of that.
Russia.
A
again.
lot
Yeah,
of
a lot
that
of
happens.
Russians.
Two
Yeah.
Russians.
Whoa,
Not
I
a
would
spy.
never have guessed it.
A lot of that happened. My husband was a doctor, and one of his technicians had been a doctor in Russia, and he didn't want to go back to school or
yeah.
take the. So he just had to be a technician.
Some of the
as opposed
students
to, and he was qualified to be a
exactly.
doctor.
There's some students that I was studying with that were surgeons in their respective countries.
Right.
I felt out of place studying next to them when they already have this vast knowledge.
But
it's,
legally, they can't.
exactly.
And they don't want to go back to school.
Not everybody, yeah. You know, life circumstances get in the way.
Right.
What are some of the medical myths that you find yourself debunking?
Oh my God, so many. That's actually why I started. When I was a resident in the hospital, I would sit and talk to patients and see 20 patients, maybe 30 patients in a day. And I would see that they would always be fed some kind of misinformation, some kind of miracle cure promise that if you just take this one thing, this will fix everything. And then they would not want to follow the recommendations that I made of maybe making some lifestyle changes, about quitting smoking, about exercising more, or taking the correct medication that would actually prevent them from dying early or having some complication. And as a result, I said, how can I reach more than 30 people? Well, I can do it on YouTube. So we started this YouTube channel about 6 years ago, and we've been so successful in busting these myths. I think these days what bothers me the most is the supplement stuff.
Oh my goodness,
Yeah.
yes.
I'm
please.
sure you've seen crazy ads that just say
on TV all the time.
And they probably go like this. Do you wake up tired? Do you ever have aches and pains? Well, we have a medication for you.
And at the end of it, it's the only side effects are so and so, so and so, so and so,
Yeah.
and death.
Yeah. I love the and death, and they still take it.
Yes.
Okay. Now,
Well, that's the pharma ones.
Yeah, I was
yeah.
gonna say
These
yeah.
are the pharma ones. The supplement ones, they don't even say that. They're
No,
just
they
like,
don't have
we're
to.
not approved by the FDA, but we're great.
Yeah.
Because we're
Oh, man.
natural.
Yeah, we're natural.
yeah. Do you believe that maybe herbal supplements are better than prescribed drugs?
It's hard to make the comparison directly without looking at specific examples, but in general, a lot of what is sold over the counter as herbal supplements
Yeah.
is A, not what's actually written in the label.
Exactly.
Okay.
B, sometimes they put in prescription medications into the over-counter things. Like we've seen that with steroids, with amphetamines, with Viagra. Like there have been countless prescription drugs found in over-the-counter stuff. So I don't feel it's a safe industry right now. And if we found something in the natural community that worked and was so proven, it would become a medication. then.
Yes. No, what I was thinking in more specific, if I'm pronouncing it again, ginkgo biloba.
Yep.
Does that work well for the memory of seniors?
Yeah, that's like the thing that it went viral like 2000s,
Yeah, I was
early
gonna say,
2000s, where
at
people
least.
were talking about it a lot. And the information came from research that was done in test tubes and in animal models. And last I checked, none of us sitting here are test tubes or animals.
No. So
Well, I guess we technically are animals, but we're not mice.
Right.
And that's where most of these studies were done. Like, for example, I'm never going to say vitamins are bad. Vitamins are essential for all of us to live.
Yeah.
But having more than normal levels isn't better.
Okay.
It's like putting more fuel in your car and expecting it to be faster.
yeah.
How do you like turmeric?
I think it's yummy. I like putting it on my salads, in my tea sometimes.
Yeah.
There's some anti-inflammatory properties. There's some skincare products that occasionally will cross the BS test and work. But in general, we shouldn't look at it as a miracle cure.
What does that have to do with skincare, turmeric?
Well, when there's anti-inflammatory properties, sometimes people get acne that is really inflammatory. So they get redness, irritation, in rosacea, you start seeing it. So there are certain instances where people use turmeric as an ingredient.
Oh, I didn't know that.
There's
No.
a new thing that's going around now with the keto diet
Oh, yeah.
and the keto gummies.
Yeah.
Tell me about Well, the diet, I understand diets do what diets do, but the keto gummies, are they effective or are they dangerous?
I wouldn't ever really recommend keto gummies, mostly because I don't consider myself a fan, particularly of the keto diet,
Mhm.
because it's a very restrictive diet. It's a very specific diet. And the diets that are successful, which is really rare, for people to lose significant amount of weight and keep it off after 5 years is like single percentage points of success. So like 95% of the time it doesn't happen. And when you put someone on a keto diet, the success rate of that is even lower because it's so restrictive and presents certain risks by overeating fatty foods, saturated fat foods, which increases risks of heart disease. So I would never recommend that as my first choice, second choice, or even third choice of diets. And all the supplements, the coffees with butter in them, and all those things that come with the keto, not a fan of those products as well.
Mm. Now, I don't know if this is something that I learned because of the circle I was running in, but is there sort of like a pandemic with young kids? I mean, in their 20s, doing Viagra and all these different things?
Is there a pandemic? I don't know if I would say there's a pandemic. I would say that probably rates have gone up. And I think the rates have gone up because of those companies where you can log on online, say you have a condition, almost like self-diagnose yourself, but because you're requesting a medication, but they technically have you see this doctor where it's not a true doctor interaction. And you check some boxes that you don't have any side effects, you don't have any interactions, and then they prescribe it to you. And I feel like that does people a disservice. Because if a young person comes to see me and requests Viagra and talks about erectile dysfunction, which shouldn't be an embarrassing topic, we should be able to talk about it in the confines of a medical visit, I need to be able to figure out, is this due to something going on in their psyche? Is this due to the fact that they have early heart disease and they have blockages in their arteries? Because that's way more of an important conversation than just, here's a prescription and forget about it and move on. That's the worst type of doctor, who just prescribes and doesn't ask any questions and doesn't think about their actual patient.
But most doctors don't do that. Do
Well,
they?
I hope they do. And that's the goal of what I'm hoping, that more doctors, as they get educated, they realize that we're not just prescription writers.
That's what I mean. Most doctors do not just take my word for it that I need this or that
They
and
don't.
send me
Okay,
home
good.
with it.
Good. Because, we're not a menu. Like, it shouldn't be treated like a menu.
Exactly.
And the reason why is not because we shouldn't be friendly to our patients or seek what they want. If what you're asking for is reasonable and it makes sense, I'll be happy to prescribe it. But there are some instances where it could be dangerous.
Oh, because they see it on TV and they say,
Exactly.
oh, please give me this because this is exactly what I need.
Exactly. Those commercials that we just talked about. In America and New Zealand, the only two countries that allow direct-to-consumer advertising of pharmaceuticals.
Why?
That's amazing.
It's a great question.
What's the
Don't have an answer? Probably lobbying.
Agreed.
What's the difference between you and I don't know what you do on your internet presence and me watching the 20-minute video that they're going to sell me this drug on? How would I know the difference between the two?
The difference is when you watch someone, and I won't even say it's just me because there's so many other great doctors online and on television who do great work like this. Anytime you start seeing them talk about nuance, not making promises, not thinking that they have all the answers, basically not being afraid to say, I don't know, that's a good sign that you have a good doctor or a person of authority. Because there's so much we don't know about the body. It's really incredible. Like, I think that's why people have a little bit lost trust in the healthcare system. You come in to see a doctor and you say, doctor, what's wrong with me? And they say, well, it could be this, it could be this, it could be that. And then you're like, whoa, well, you're not even sure. Do you even know what you're talking about? And then let's say after some testing, they say, well, I think it's most likely this. You say, well, will that treatment work that you're giving me? We as doctors, we hedge our bets and we say, well, it works for most, but I can't be 100% certain that will work for you. That's the honest answer. But the people who are selling you snake oil, the charlatans out there, they will promise you that they have something to fix whatever is going on. They will be definitively sure of what's going on with you without ever examining you. How many videos have we seen online of someone saying, do you have headaches? It's because you don't have this pink salt.
Yeah.
Like, how can you know that?
What?
Right.
Yeah.
Yeah.
What's one medical myth that you encounter you wish more people knew the truth about?
I think that there's a lot of worry about vaccinations. And I think it's important to talk about the success that vaccines have had in the world, how we've completely eliminated diseases because of vaccines.
Polio.
Exactly. Polio is a prime example. Like I saw a tweet the other day that made me borderline lose my mind, where someone says, why do we even get vaccinated for polio? We don't even see it anymore.
Well, that's
Yeah.
funny.
Why do you think we don't see it anymore?
That's a
But-
young mind.
Yeah, exactly.
But what about the fact that we've gotten to a point of giving young babies 11 shots at one time?
That's a reasonable concern. Well, we give multiple shots to young children. We have the 2-month visit, the 4-month visit, and the 6-month visit where you get multiple shots at once. And the answer to that is simple. The amount of, because the way a vaccine works, it shows either part of an infection or an inoculated infection, meaning like the weakened version of the infection. And through that, our body creates an immune system response so that we actually are protected if the real thing were to ever come along. And those numbers of what we're presenting to the children's immune system is tiny. The amount of bacteria that they're exposed to in the world, the amount of viruses circulating around, pales in comparison to what we're actually giving in the actual vaccine. It's tiny if you compare how much virus we're introducing with virus particles, I guess, that we're introducing versus what they're actually exposed to just being alive, playing on the floor, going through the birth canal. Completely capable of handling that load.
But what about the people who are saying that autism is caused by too many shots all at once? Not too many shots in childhood, but too many shots at one time.
What happened was there was a study that was done, and it started linking that idea in people's heads. And when we further looked into that study, we actually found that it was fraudulent. The information was made up. The person who conducted the study lost their medical license. But that was already enough to scare folks because you don't want to do anything to harm your child. You want to do what's best for them. So that idea started circulating and gaining traction. And what is true about that situation is that there exists a correlation, that two things happen at the same time. But just as you all know, things that happen at the same time don't necessarily impact each other. In the summer, can we agree that we all eat more ice cream? Right? It's like
Unless we don't eat ice cream.
Well, yes. But if we do, like the general public, we could say eats more ice cream in the summer.
Right.
There's also more shark attacks in the summer, right?
Mhm.
Because people are spending time at the beach. But if we reduce the number of ice cream sold, will we impact how many shark attacks happen? No, because those two things are correlated, but they're not causation. Ice cream and shark attacks correlate, but are not causative. And that's the same thing that's been happening with this conversation surrounding autism and vaccines. The rates of autism have gone up. We don't have the answer as to why. But the fact that more vaccines have been given in that time is not a causative impact. Just the fact that two things happen at the same time.
Got it.
Yep.
Why do you think that autism has gone up?
No idea. I do not have that answer. And it's hard to tease out that answer because so much has changed in this time, not just vaccines. Technology has changed. Food has changed. The weight, the pollution, our environment has changed. So many factors have changed, and it's so hard through research to be able to control 3 factors, let alone the millions that are surrounding us every day. So we don't have the answer to that yet. And if I was willing to compromise my ethics and sell some miracle potion, I would tell you with certainty that I knew that answer. And that goes to answer the question about how we look at real experts. The ones who sound confused are probably the ones telling the truth.
Well, I'm a big believer in doctors telling me the truth.
Okay.
So I understand that, but I don't know. Some doctors don't favor vitamins or supplements at all. So before you get the name out of your mouth, they're already saying no.
Yeah, I think we need to be more open to integrative therapies in traditional medicine because there are valid times these things could work. We just have to be honest with when they do and when they don't. And to fully write them off is unfair. But at the same time, the majority of cases where we thought they might work, even when people invested money and did the research, we found that they didn't. And the truth that they have an impact was either so small or actually worked the other way and caused more troubles. We actually found that in some cases, men who were taking extremely high levels of B vitamins actually had higher rates of lung cancer. So there's all these correlations that exist, but to tease out exactly what's going on is so difficult to know the answer. But that doesn't mean we're powerless. When you eat healthy foods, fruits, vegetables, leafy greens, you're getting all those vitamins and minerals. So I'm a fan. I'm just not a fan of unnecessarily taking them from a capsule and paying a company to get them when the food is the much better choice.
How do you feel about the pharmaceutical situation in the country?
I think it's gross. I think it's putting profits over patients.
Yes.
We saw that with examples like the EpiPen scenario, where an EpiPen can save someone's life if they're having
$500.
$600. It was ridiculous.
Overnight.
And they bought it they bought the company and it was $100 a pen. And they said, well, why not? People are still going to keep paying for it. Let's just jack up the price. And they treated it like a commodity.
Wow.
And it was so messed up that was going on. And that's why I feel like healthcare is a field that you can't Uberize. Like you can Uberize taxis, you can Uberize alcohol delivery, food delivery, like those things, it makes sense.
Right.
But healthcare, if you try and squeeze out profits when people are suffering,
Thank you.
that's where it gets really messed up.
Thank you.
That I was a limo driver and I used to drive the stockholders in Big Pharma, and the dialogue that went on.
Yep.
You see, when you have to, there's a thin line those people have to walk. They have to not kill everybody, but they also have to make money for their stockholders, or otherwise, it's talk about a balance that's much needed.
Yeah, well, ideally we would shift incentives so that the incentive is to research and develop new treatments and medications to earn more money and not just take existing things that work and make it more expensive and just rob people blind.
That's what they do.
That's what they're doing.
What they do.
Yeah. So the incentives are really wrong.
Do you think we'll ever get to a time when the medical field is more concerned about keeping people well than treating sickness?
I don't think you can ever say one is better than the other. I think you always need to treat illness, but at the same time, you want to think about prevention. So I think it's the balance of the two that's really important.
And during the COVID thing, they never said if you're overweight, if your immune system is compromised, you have more of a chance of getting it or dying from COVID.
Wait, who never said that?
No,
said
I
that.
never heard anyone
They
say
said
that.
Well, it's because
They
you weren't
said-
subscribed to my YouTube channel, clearly.
That's right.
Yeah.
That's right.
An interesting point in talking about the pharma situation is that when you look at how pharma spends their budget, their money across the United States primarily is spent on advertising and
Right.
reaching consumers
Right.
rather than development of new medications.
Right.
So part of the problem that we mentioned being one of the two countries where they're spending so much money educating folks, it's really dicey.
Yeah.
Really, really dicey.
Yeah. But then you get the paperwork. And then you get to the doctor that's got so many patients that he's watching and he's in with you and he's going, okay, I got 5 minutes and 32 seconds
Yep.
left.
Yep.
Or
you're
make
like-
another appointment.
Yeah.
We'll have you back in again. Another appointment.
And it's not necessarily the doctor. He's been forced into the situation, like when my son was born. I remember going to this great pediatrician, wonderful guy, looked like a little happy bear. And he was like that to all the kids. Everybody thought he was a teddy bear. And we'd go in and see him, and he had a beautiful little office and a great room. And over the years, his office kept getting smaller and smaller, But the front office kept getting bigger and bigger and bigger. And, he had 3 or 4 ladies by the end of the day. And that was all just to handle the paperwork.
You're pointing out one of the biggest changes in healthcare over the last 20 years. Healthcare spending in the United States has skyrocketed,
Right.
but it's not because we have way more doctors. It's not because doctors are paid more.
Yeah.
It's because the administrative burden
Yeah.
has quadrupled, if not 10x.
And
Yeah.
why?
Because I'll explain. When I prescribe a medication, that medication then has to have a prior authorization process to make sure the insurance will pay for it. But the doctor has to be taking care of patients. So we have an employee to handle that. Then when the insurance company denies and doesn't want to pay the physical cost of you being seen by the doctor, someone in the billing department has to argue that and make sure that the notes are done correctly, that the billing department actually pays of the insurance company. Then you have to have a scheduling person to deal with all, and you create positions, 4 positions, 4 positions, 4 positions.
Okay, you said the magic word, and that is insurance.
Okay.
So let's talk about insurance.
I didn't know that was the magic
companies
word.
and the horrible way that's impacted our medicine in this country. What would you like to say about that?
The insurance company situation is a disaster from even from my standpoint as a patient, not even just being a doctor. First of all, doctors, we have no idea what things cost. There's no price transparency for us. So what one person pays for their medication that I'm prescribing will be completely different what another patient pays. And that's already weird. Because if you call, let's say, in a non-insurance but still medical space company and you say, hey, how much does it cost to get a nose job with your doctor? They'll tell you. And then you can call another office and compare and price shop. But in a scenario like where you have one pharmacy selling the one drug that you need and you can't get an answer of how much anything costs, you can't price shop. You can't be a good consumer. So very messy on that end. Second, in America, we have this hybrid system where sometimes the government gives insurance support, sometimes it's your insurer, sometimes it's private or individual and you pay for yourself. For example, for myself, I have a small team that I make YouTube videos with, and I provide health insurance for them and for myself. And because I have such a small number of employees, cannot bargain the same level of insurance coverage that the banks can get for their employees.
Oh, wow.
So the insurance that my employees have and I have is much worse, even when I pay the same amount. How messed up is our system?
Well, yes. And what do you think about countries who have totally different kinds of health care, and people who are making a lot of money in this country say, oh, no, it's not as good as ours. It's not as good as ours. I don't believe that. What do you think?
It's more humane, for sure. It's more ethical. And at the same time, they're also having troubles. The UK is having troubles with the national health system.
Right.
Canada, they're having problems with their
What
healthcare
kind of
system.
problem?
Problems of making sure that they have adequate care, funding. In the UK, they're having terrible issues with funding their national health services
And why is that?
because the government, when they say we're going to foot the bill for the cost of healthcare, will decide how much of it they want to foot the bill. And they constantly have to redistribute how much money goes to the healthcare
Politicians.
policies. Yeah, of course. So it's very messy. And I have yet to see a perfect solution in a country like ours. Because there are countries with smaller populations, less diverse, that have less immigration, that say, we have it figured out. I'm like, well, great. That's not applicable to what we're doing here in the United States. It won't necessarily work here. But we definitely need an overhaul. And something I just said the other day that got me really mad, talking about the situation of the doctor feeling like they need to run out.
Yeah.
I do feel like doctors are gaslighting their patients more, feeling like rushing them, maybe not caring as much. But I don't think it's because doctors have become less sensitive or less ethical. I think the system forces them to behave in this way because of how broken it is.
It is, yes.
And one of the most disappointing things that I have to tell people, which is it's even embarrassing that our healthcare system does this, is that we get mad when police officers have quotas to write tickets.
Right.
Right? Because we're like, that's messed up. You shouldn't force them to give tickets.
Yeah.
But doctors have quotas of how many patients we need to see.
Right.
Yeah.
That's where we should be furious. The ticket is annoying, whatever. But if we have quotas and we have to run out and not give good care and someone's suffering as a result, I think that's where the biggest failure comes
Wow.
from.
Yeah.
Yeah, I agree.
Medicine was never like that 40 years ago.
Yeah.
I mean, it's really gone downhill.
It's a shame because in some ways we've made all these breakthroughs in being able to prolong life, to cure certain illnesses. I mean, if we think back to the AIDS pandemic, that was a scary time. Hepatitis C, scary time. Now, HIV, AIDS, chronic illness that you could take a medication for and live the same length of life as someone who doesn't have HIV. Hepatitis C used to be a terrible disease. Now we have treatments for it. So there's been so much innovation, and yet we hate it. That means we're doing something wrong.
Yeah.
And I feel like we need to encourage younger doctors to be excited about making this change and think that health is equally important when you're talking to a person individually, when they're your patient, and when you're talking about on a broad level from a public health standpoint, from a policy standpoint.
Could you tell us the difference between an office visit with you online and an office or a teledoc online or seeing an actual doctor in the office?
Yeah, I think telehealth has a good place in healthcare because there's some visits, for example, if I'm checking to see if a patient has side effects from their medication. And let's say I see them on day 1 and they say, in 2 weeks, I'd like to see you to see if you're having side effects. Maybe they don't need to come in.
Yeah.
Maybe we could just do a telehealth visit, check in. The patient said, I'm doing great. I have no side effects. I feel amazing. And we don't need to do a full physical exam for that. But then try doing that when a patient calls in on a televisit and says, I have abdominal pain. How can I check what's going on? Is it the kidney? Is it the stomach? Is it the intestines? Is it the appendix? Without doing a full exam. So there's shortcomings, and then there's ways that it could work really well, especially with specialists. In certain parts of the United States, there's not adequate access to very specific types of doctors. And if you live very far away and you can't see them, that might be the difference between life or death. Whereas you could see them virtually, they could give you some recommendations about blood tests, imaging that they can review virtually, and then give you recommendations about possible treatments. So there are utilities, but we need to be sure that we don't then take it too far and let the pendulum swing too far and say, let's let all these financial guys run these companies and then just start making everything telehealth where you can come in, just write your own diagnosis and request whatever medicine you want. That's just not good medicine.
No.
Have you had any experience where your online presence helps someone's health decisions?
Oh, that happens a lot because have you guys watched the show Grey's Anatomy?
Yeah.
Yeah.
Okay. Are you fans?
Yeah.
No.
Oh, okay. So
10 to
yeah.
15 years ago when I started.
Yeah.
It's a soap,
Yeah.
right?
Yeah,
Basically?
yeah.
I'm ashamed of myself.
You don't
Why?
watch it?
You don't watch it?
Still watching?
I've never seen an episode.
Oh,
Well,
you're
that's
okay.
okay.
I saw
Ben
2 or
Casey,
3
Dr.
episodes,
Kildare.
and
Dr.
I
Casey,
have not seen the rest.
Well, the thing that they do wrong on that show so often is they don't do chest compressions. When someone's heart stops, they go and they run to get the defibrillators,
Right.
the paddles,
Yeah.
because that
What
looks the
Oh,
coolest on television.
Yeah.
more
More dramatic.
More dramatic.
Yeah.
But in real life, if someone's heart stops, the first thing we
Boom.
do in the hospital, here in this room, we start
the
chest
blood
compressions.
going.
Yes. The purpose of it is to keep the blood going even though the heart has stopped. And in my YouTube channel, when I would watch these episodes and I would react to them, I would find myself screaming, chest compressions, chest compressions. And from that, we've been able to teach people through a partnership with the American Heart Association how to perform chest compressions. There's actually dozens of airports in the United States that have a CPR mannequin with my face teaching folks how to learn to do CPR.
Yeah.
And we have stories of people emailing us how they, from learning CPR, either in one of those booths or through one of my videos, have saved the life of one of their loved ones.
There's been several news stories about a young child saving like his mom's life while he's on 911 because he's doing that.
Yeah,
He learned
exactly.
it on TV or saw it somewhere else.
Yeah,
Absolutely.
So that's one of the more rewarding
Yes.
emails that I get.
Yeah.
Where does the Heimlich thing come in on that list?
If someone's choking, it's important. Yeah, very important to be able to do it properly.
Yeah.
Someone
Yes.
choked here?
One of us, yeah.
Yes.
Oh, and who saved you?
My boss, Brandon.
The
That's why I'm
producer.
still on the show.
Okay.
Because he said, no, I took too big a chunk of a bagel, too hungry.
Okay.
and they thought I was joking
Mm.
until I turned red.
Okay.
And then Adi, the other creator, came over and he goes, "Is that too hard?" And then he just came with one big boom, and it came out, and I went back and had a little small piece of bagel.
Okay.
But it was, and then just to relieve the tension at the end, I said, "Oh, today I got really choked up."
Yeah.
Just to relieve the tension. But it was like, I was blessed that, yeah.
Well, I'm glad. Yeah, the
saved
Heimlich
me.
maneuver is one of those first aid things that is
Yeah.
very, very
Yeah.
important to learn.
Tell us about yourself. What made you want to be a doctor, and how young were you when you knew that you wanted to be a doctor?
I probably was in high school, and I remember I had a teacher in high school who was my science teacher, biology, and he was a retired doctor. I think he was a foot surgeon. He explicitly told me I would never make it as a doctor. And I like proving people
Challenge.
wrong, and I like being competitive, and I wanted to show that I could do it. And I also really liked it, but that added the drive. When someone says you can't do this, when someone says you're a doctor, there's no way you're going to box, I'm like, I'm going to do it. So be careful if you guys challenge me today. I might just go do something wild.
No, it's okay.
How old were you when you came from Russia?
I was 6.
Okay.
Oh, you guys coming up.
Youngin.
How
No.
hard was it to learn English?
Not hard. When you're coming that young, the
Young.
mind is so quick to pick things up.
Yeah.
I actually picked up a little Spanish, even treating some of my patients now. So I have some broken medical Spanish that helps in emergency situations.
So a little bit of a shift in what we're talking about here. Last year, now you may not be, this may probably not anything you do in your office, but I had brain surgery.
Okay.
And it's like I have sinkholes going on up here.
Okay.
I mean, is that anything for me to be concerned about? Like, is it going to sink and touch my brain? And what is this?
This is the beauty of what I do on social media. I get questions like this so often, and this is the tricky part of wanting to be a good doctor online. I would love to answer your question, but I can't because you're not my patient. And why can't I answer your question? Because I don't know what procedure you had. I never done a physical exam on you. I don't know what normal is for you. I don't know how long the recovery has been. So for us to fully give you a good answer, we would require all knowledge of all of those things. So I can't say outright what's going on.
That sounds like Big Pharma, doesn't it? No, I'm
Big Pharma would promise you an answer. They would give you a solution to the thing.
I'm joking. Okay. Yeah, I understand.
Yeah.
I just, yeah.
Let me tell you that I was in his car, and he was driving me home from the set. And I knew something was terribly wrong. And I have always regretted that I even let him back out again and keep driving to get to his house. But his wife was so smart. The moment he got there, she rushed him to the hospital. It's tough when you know what to do, and it's tough when you don't.
I think that brings up a really valuable point of when is it time to go seek help? A lot of people say, well, how long should I wait with this condition? When should I go see the doctor? And that's a good question. But the answer is, if you're thinking about it, go. That's it. That's the trigger.
Yeah, and if you're worried about it, you're late.
Yeah, exactly.
Yeah.
That's the time. Like,
Yeah.
this is the time to go, because the worst thing that could happen is you go and you get some reassurance. Some of my young residents that I train to be future doctors,
Or that you don't go and you die.
well, yeah, that's true too.
That
Some of the young residents that I'm training to become future doctors, I frequently tell them, they say, well, I feel weird telling the patient that this is just a virus and that there's no medicine that they need. They should just hydrate and sleep. Feels like I'm not giving them anything. Reassurance is something.
That's really
Because so many of us are coming in because we're worried that this could get worse or this is something really bad. So when a doctor tells us, hey, I've looked at all the possible options. I don't see that there's red flag situation here. I think that this is not that serious. I think you would get better if you just do 1, 2, 3 simple things.
right.
That's giving a patient something.
Yeah.
And we need to be, as also consumers and patients, happy that a doctor is doing that and not feel like, oh, we didn't get a medication. What was the point of that?
Right.
You got a really good evaluation and the truth, as opposed to selling you a miracle thing.
Yeah, we were speaking about pharmaceuticals earlier and the Viagra problem, but Adderall, I mean,
Viagra problem.
has gotten so well. Which came first, chicken or the egg?
Viagra or the
But
Adderall.
No pun intended. But now the Adderall is across the age groups, and especially for teens now, and that just came out of the blue, and that's a prescription drug, so it can't be just going to mom's medicine cabinet or dad's medicine cabinet. Where what's going on here?
Well, the medication has legitimate uses for conditions like ADHD, attention deficit, and hyperactivity disorder. And there are certain patients who really would benefit from it. And not just benefit from the way that we think, like, oh, their attention will get better. But when one's attention gets better, they're able to hold down a job. Their mental health improves because they're able to have better security from work, financial stability, better relationships. They have less likely to get into accidents, car accidents, and lose their lives unnecessarily. So there's benefits for those medications to be taken when appropriate.
Right.
And then we have young folks who are experimenting with those meds or who are using them for their unintended purposes, like you would see with testosterone use for someone who wants to build huge muscles and using them as steroids. This is what I feel like is the performance-enhancing drugs space.
Right.
And I urge all students to not do this. Not only is it going to set you up to feel like you always need this thing because you'll never perform as well when you're without it.
Right.
But you're also going to get all the nasty side effects without the true benefits that you would get if you had the condition that warranted you taking the medicine in the first place.
And what about all those weight loss drugs?
Oh, there's a lot of them.
Like Ozempic.
Well, this is what's interesting about the snake oil salesman world. They like to function in this space where medicine doesn't have good answers. And 20 years ago, that was in the weight loss space. So they would sell you fat burners and lemon potions to burn fat and all these fad diets. And now in healthcare, we have drugs like Ozempic, Wegovy, Mounjaro. These are medications that actually help people lose weight. They're really evidence-based. They're proven to do this. So now all these snake oil salesmen are moving away from the fat burner space and moving into the new space of anti-aging, which I think is pooey.
Yeah.
And the reason why I think it...
Is that a medical term?
Yes.
Pooey. Pooey.
Because I think everyone in this room can agree with me. Maybe you don't. I'm curious. I don't view aging as a disease.
Yay.
It's not.
We can't disagree with you.
That's what I'm saying.
Yeah.
I think there's aging well, and then there's aging poorly. And if we didn't take care of our bodies, or we are unlucky enough to have a condition that makes us age poorly,
of junk forever.
Yeah, so it could be because of choices, but I also don't want to make people feel bad if they have a genetic condition or they were unlucky and were in a trauma or some other situation. So thinking about it broadly, aging is going to happen whether we like it or not. You can't stop aging. And time that someone tries to sell you some anti-aging thing, pooey.
Yeah.
Pooey.
When, Doc, I don't mean to get too personal, but you got some big guns there.
He boxes.
Well, it's because of the boxing. I got to stay in
the
good
boxing.
shape. I got to fight these
you
guys.
Didn't take anything to get them things pumped
No.
up?
Oh, no steroids.
I don't even take I'm not a huge even protein or creatine fan. I don't take much supplements. Occasionally, if I feel like I haven't eaten enough protein, I'll have a shake, but it's so benign.
Yeah.
The thing that I tell folks when they say, oh, should I take protein supplements if I want to get in good shape and all this stuff? It's okay. 70% of it is going to be your diet. 25% is going to be your exercise routine that you choose, which one you do. And then the 5% is supplements.
Yeah.
So once you have the 95% already figured out and you're doing it for a long time, then you could talk about supplements. But if it's your first day in the gym, doesn't matter. Yeah.
Doc, don't forget to tell us about the airplane incident.
Oh, the airplane incident. That was that was like a Grey's Anatomy episode in real life.
Where were you going?
I was flying to Israel with a nonprofit to talk about some of the healthcare stuff that was ongoing there. When they make that dreaded announcement on the plane, is there a doctor on board? And I'm wearing like a hoodie because I was going to take a nap, and I was in my slippers and ready to go to sleep. And I find that there's a young man who's developing anaphylactic shock.
Oh, gosh.
His throat is closing up. But I wasn't worried. I'm a doctor. I said, where's your EpiPen, buddy?
Yeah.
He goes, oh, I don't have one. I'm still not worried. I presume that the emergency kit on the plane will have an EpiPen in it. Yeah. I open it. I'm like, no, there's got to be something I'm missing. And keep in mind, I have minutes here before his throat fully closes up because we're over the Atlantic Ocean. There's no landing.
Yeah.
The pilot says it's an hour and a half back to Canada or an hour and a half to Portugal.
Oh my
So
God.
there's no going anywhere.
Yeah.
So we're stuck on this situation. I look. There's no EpiPen. And we have to save this young gentleman's life very quickly. So I find that there's a medicine called epinephrine, which is the main ingredient in EpiPens, for someone's heart stopping. So same ingredient, different dosage,
But in
much
a-
thicker needle.
Yeah.
Much thicker needle. So I say, I'm sorry, sir, but I'm going to have to give you this giant needle with an uncertain dose because how am I going to calculate this dose into his thigh? So we have him pull his pants down right there in the first class cabin, give him the EpiPen, open up his throat, and he survives. I check his vitals the rest of the plane ride home. He gets carried off to the emergency center once we land. And then I met him a few days later while he was on his trip, happy and enjoying it like nothing ever happened.
Wow.
He didn't
Happily ever
He
after.
didn't care nothing about how big that needle was.
After that, right?
Yeah.
And he blows kisses every time he sees
oh,
someone
yeah.
in a hoodie.
For sure, yeah.
Yes, indeed.
He had a unique situation where he developed a red meat allergy due to being bit by the Lone Star tick in the South of America.
Wow.
Lone Star tick.
Yep.
Oh yeah, I heard.
It's a
they were
rare
deadly.
condition that you can develop. So
Wow.
he had an allergic reaction to red meat, which he wasn't aware of, and that's why he had the reaction. So pretty incredible story. And the happy ending is not just that he landed. I guess the funny ending is when we landed, all the other people on the plane were thanking me. And I said, "Oh, you're thanking me because I saved this young gentleman's life." They go, "No, we're thanking you that you didn't divert the plane and we're not delayed."
Oh my God.
That's how people. Are.
Exactly.
Yeah.
And then to
Really?
make the story better, I thought, oh, well, maybe Delta will reimburse me for my flight. Because like I saved this young gentleman's life. We didn't have to divert all the savings. They said, you know what, we want to thank you. Give us your frequent flyer number thing and we'll thank you. $100
Yeah.
credit
And
added
si-
to my account.
$100.
Thank
That's
you.
All?
That's not even a doctor's
I was
visit.
like, yeah, I was like, that's not even my copay.
And, yeah.
Terrible.
And sign this insurance release.
Yeah, exactly.
Yeah, exactly.
Oh.
But then with what the happy ending is, working with Senator Chuck Schumer, who's the majority leader in the Senate, we were actually able to do a press conference to put pressure on the airlines to put EpiPens on planes.
Yeah, I'm
and now the
amazed they
majority
don't.
of them have EpiPens.
Yeah.
We're still working to get them all to have it, but at least the majority now do. So
Mhm, mhm. Wow.
Wow.
Since okay, that's okay. Let me get back. What are some practices for seniors to practice preventive care for seniors?
yeah, I'm big into preventive care because I'd much rather prevent the fire from happening rather than be putting it out and then it's an emergent situation. The number one thing is stopping really, really bad habits like smoking.
Yeah.
And also improving physical activity.
Yes.
And when we say physical activity, most people say, well, I go for a walk. That's good. But if we could also include some resistance training where you use either some dumbbells or some bands or some kind of exercise like that, Pilates, you not only strengthen your muscles, but you also strengthen your bones. You also improve your balance. You have less
Balance.
chance of falls. You stay independent for longer. So it's not just about extending life. It's about also thinking about having the longest quality of life throughout your years
What
and
was-
aging well
Yes.
instead of anti-aging.
Yeah.
Yeah.
Ooey.
Yeah, our big thing is aging is wonderful. It's full of surprises and love, but don't let them trick you into getting old.
Yeah.
Yeah.
I'm gonna live by that mantra.
Yeah. Or
Don't
acting
I
like
hope
it.
you don't trick me into getting me old.
You never have to act old.
You don't.
Yeah, no.
Right, I don't.
Yeah.
Okay. I'm
Stop
gonna,
You
it.
know, yeah.
Stop it. puppy.
what about when my back hurts and I try and get up in the mornings? What do I do then?
Yeah.
That's some advice you can give me.
Yeah.
In bed before you get up.
Absolutely.
You stretch in bed before you get up, and I
Smart.
do stretch.
I should
in
cat
bed.
cow in the mornings.
Cat cow?
Cat cow.
Oh, you mean like this? Yeah.
Yeah,
Yeah.
cat cow.
Yeah.
So,
Yeah, and more. You should do and more.
You thought I was giving a supplement, right?
Wow.
We would know the difference.
Cacao? Is that
Yeah.
how?
Cacao.
You could
The cat
sell-
cow.
you
Yeah.
could-
You
It's
could
good for the
sell us
back.
some
you
of
could
that.
do, you could do more than that.
Yeah.
And crying baby.
Oh yeah.
After you stretch your legs
That's
back,
true.
that'll open up your back and make it feel better before you jump out of bed.
I'm going to do
Right.
that more often.
Yeah.
You're right. I've been
Yeah.
neglecting my stretching and mobility bed routine.
Right, you'll feel much better.
Okay.
Now you have to give me your address so I can send
Yeah.
you.
Send you the bill.
Wow.
I just got hit with a
Here it comes.
copay.
Do you have health insurance? He's got to
we don't call her
I
Bubby
just
for
said
nothing.
I have bad health insurance. You sure you want it?
Okay.
You know,
I come from a family of doctors. My grandfather was a doctor. My uncle was a doctor. And back then, he had a clinic in the late 40s, early 50s. They had an x-ray machine. They had therapy rooms. They didn't have to send out their labs. And so he was really ahead of his time. What do you see as the future of medicine?
Oh, that's good. I see better visualization into the body without needing to cut into it. So like right now we have to get colonoscopies to reduce colon cancer rates.
Right.
But I think in the future we'll be able to have such good imaging that we might not ever need to even go and put a camera up our bums to find
Right,
diseases.
right.
Also, I think with AI, where it could help us is to create better algorithms to know who would benefit from a medication. And I'll explain. When we put on our seatbelts, what do you guys think the likelihood that the seatbelt will save our life, percentage-wise? 90% save your life? 90%?
Yeah, something
90%?
around there.
well,
90%.
I've been in some incredible crashes
Okay.
without a seatbelt. So I think that if it's your time, it's your time.
Okay.
If you make it through, you make it through.
Fair. Okay, so not very optimistic on that one.
50%.
But we're thinking around it's very effective, 90%.
Yeah.
The actual success of a seatbelt is 99% not effective.
Yes.
And I'll explain why.
Yes.
But it's not the reason you probably think.
Yeah, no.
Because you need
None of that.
25,000 people to put on a seatbelt before it saves one life.
Wow.
Because many of us don't get into car accidents when we drive. Or even if we do, it's not even going to be a difference whether or not we were wearing our seatbelt.
Ooh, you should come to California. We're filled with accidents.
Yes.
But that's the statistic. So 1 in 25,000 people will be saved. But that means 25,000 people need to put on their seatbelt. And why is that interesting? Medications work in the same way. When I prescribe a medication to lower someone's blood pressure, I don't know which one of the 80 or so people that I'm prescribing it to, it's actually going to save their life and prevent that heart attack. But if the algorithms get smart enough to target it to the right person, or at least a smaller number of those people, less people will be on medication for no reason. Less people will have side effects from those medications. So imagine I could only put on a seatbelt on the one person that I know it would benefit. How awesome would that be?
Yes.
That would be
yes.
awesome.
Because then it would be
awesome.
100% success rate.
Yes.
Yes.
100%.
That's
So-
kind of what they're doing with cancer now, isn't it? Where they this radiation, you take it one time for 5 years, and they target.
Yes, the targeting got much better with the
Yes.
radiation. So
Yeah.
similar concept
Yes.
there. And that's with the help of nuclear physicists and
Right.
not just doctors. They're brainiacs in those rooms figuring out those things. So I think there's a lot of really cool therapies like cyberknife. There's all cool ones coming out constantly.
Do you
Right.
think that vibrational treatment of any kind
Sound.
ever is
Like
something?
the percussion guns, like those types of things. I think that they can help. Are they curing anything? No. But they can help. There's some instances like ultrasound therapy can help speed up fractures.
Yeah.
There's some evidence of that. There's some cool stuff. But none of it is so much so a game changer that I would say start vibrating right now.
so
Okay, we won't go there,
Yeah.
but
very nice. Yeah.
Start vibrating right now.
So
All
now
right.
we got a Viagra problem, and now we've got a
Vibrating.
problem.
Whatever I do, I should start
my
vibrating.
God.
I
see what
love
you
it.
got yourself into here.
Oh
with
my
this.
God.
But reform of human beings will help medicine, lowering pharmaceutical costs and
Yeah.
and making the right calls on insurance and all of that. That you've already explained very carefully can help medicine.
Without a doubt, improving access will save lives because the very simple thing that happens when a person has coverage, they go see their doctor for
Right.
preventive visits. Therefore, the problems don't work themselves to the worst form.
Right.
And that's why our insurance companies kind of suck. Another added reason is that when you are covered by one insurer, it's oftentimes that you're going to swap insurers in the next 5 to 10 years. You either switch jobs or you get a different insurance carrier. But if you had one insurance carrier your whole life, they would be really interested in prevention because they would know they would save money.
Wow.
But right now, they are only covering you for a short period of time. They don't care about investing in your prevention. So I think if something changes there, we're going to have better outcomes as well.
Well, we think you're wonderful.
Thank you.
Yes.
I appreciate that.
Well, we thank you very much, especially for the advice to help out, to
Yeah.
stay healthy for ourselves and what to take and what maybe not to take.
Yeah.
But thank you for your time and your genius to help us
Yeah.
out to know what
And
we're
be
getting taken.
careful. Don't get arrested with them guns.
Yeah.
On the streets of New York City, you need all the protection you can get. So.
Yeah,
Yeah,
there
we'll
you go.
follow him. We'll just go out and follow him.
He can walk us to the Uber. Yeah.
There you go.
And we
Thank
want
you.
to thank everyone who has been listening today and watching today. And we're asking you to please subscribe.
Thank you, Dr. Mike.
Subscribe.
Yay.